According to the World Health Organization, the third wave is picking up speed, spreading faster and hitting harder. With rapidly rising case numbers and increasing reports of serious illness, the latest surge threatens to be Africa's worst yet. This is coming on what's happening in South Africa. Well, joining us right now is Professor Jeffrey Mfalele, Vice President, Research, South Africa Medical Research Council. He joins us via Zoom. Thank you for joining us on the program.
Thanks for having me.
All right, Professor, tell us, what is the science and the data saying about South Africa's COVID-19 situation now?
Well, South Africa is in the exponential phase of cases, the third phase, the third wave of COVID-19. And this has just, started a few weeks ago. And it started in some, selected regions, and it seems to be, a trend nationwide now. But even if, most regions or provinces in the country are picking up cases, there is just one particular province, which is the economic hub of the country, Gauteng province, which is accounting for more than 60% of cases on daily basis in the last 3 weeks.
And the president said in his broadcast that this is a devastating wave. Do you expect that it will get worse? And what is the major cause?
I think what we see with the third wave is that we have got our normal virus strains circulating, the beta virus, but recent data has indicated that the Delta variant, which was initially detected in India, is also gaining momentum in South Africa. And at the moment, we have got at least 5 provinces where the Delta variant has been detected. There was one province, the province of KwaZulu-Natal, where they have done random sampling of different sites, and they've shown that actually the Delta variant is slowly displacing the Beta variant. And the data from the Western Cape is also showing the dominance of the Delta variant. We are waiting to see the data from Gauteng province, which is driving the third wave in South Africa. But the expectation is that the Delta variant will also be responsible for these cases in Gauteng province.
How much is the number of vaccines coming into Africa and then South Africa affecting the spread of the virus?
Well, the vaccination coverage is still very low, very much like what you see in other African countries. We have only vaccinated just below 3 million people in South Africa. And as you can, if you know, we started with healthcare workers, frontline healthcare workers, and then the elderly. And now the education sector is also getting attention in terms of the vaccination. So the pace of vaccination is not going according to the initial plan due to global shortage of vaccines. So it will take some time before we really reach a level where we will be able to intercept or reduce the number of cases in South Africa.
Indeed, the worry for countries in Africa. But then looking at the measures South Africa is taking to combat this third wave, I think it's 2 weeks, 14 days, the restrictions that have been put in place. Would you say that that's enough? Are they bound to work?
Well, these measures are never enough because the best measure is really a total hard lockdown. Unfortunately, at this point in time, almost 1.5 years with the pandemic, this is just not practical in our setting. So the president has announced some measures, and nationally there will be closure of schools as of tomorrow, so that you limit the movement of school children to schools, and obviously in the process transmitting the virus as well. And then the other area is the province that is driving the current wave. So for the Gauteng province, there is a restriction in terms of movement in and out of the province, and you need to justify why you visit the province and why you also live in the province. Unless it's for work reasons, then you have to justify. So these are just some of the measures that have been imposed. And the last one maybe that I can mention is the one on liquor, because there is temporary suspension of selling of liquor, on-site and off-site consumption.
All right. We really wish you and the government of South Africa the best in flattening this curve. Thank you so much for joining us on the program, Professor Jeffrey Mfulele, Vice President Research, South Africa Medical Research Council. Thank you for joining us on the program.
Welcome.